Good afternoon and warm welcome to one and all. Myself, Dr. Swati Likhite, and Dr. Neha Singh will be moderating today's session. Despite being a natural biological process, menstruation, menstruation remains shrouded in silence and stigma, affecting health and dignity of countless women and girls. Today, on account of World Menstruation Hygiene Awareness Day, let's break that silence and foster an open dialogue on menstrual hygiene. On this day, let us all join a global movement striving for a period friendly world, a world where no one is held back because of menstruation. To contribute to this mission, I welcome all the dignitaries, guests, experts, and Rotary clubs, one of the biggest NGOs in the world, joining hands together with us. I welcome Dr. Geeta Patil ma'am, who is the immediate past chairperson, Central AHA, Dr. Archana Thomre ma'am, consultant, gynecologist, Dr. Chitra ma'am, Dr. Hima Bindu ma'am, Dr. Vikas More, Dr. Gangolia sir, Dr. Neha, and I welcome all the presidents of Rotary clubs, Rotary Club of Khargar Midtown and Rotary Club of Panvel Elite, and also I welcome President Jayashree Madam, Inner Wheel Club, Khopoli. Now, I would like to invite AHA President, Raigad AHA President, Dr. Sunita Ingle, ma'am, for her blessings and welcoming the experts.
Thank you so much, Dr. Swati. Yes, it is time to break barriers and talk about menstrual hygiene today. And for that, really, we have a great panelist. So I welcome the panelists, Dr. Geeta Madam, Dr. Archana Madam, and also happy to acknowledge and welcome the presence of our office bearers of the Rotary Club Khargar Midtown, Inner Wheel Club Khopoli, and Rotary Club Elite. And really grateful for their association with this important topic today. Also, we have youth amongst us today who will be really asking questions, and it is actually targeted for the young girls and the young ladies. So I'm very happy that they are present here today. And also, we are very fortunate to have with us Dr. Hima Bindu Singh, Madam. She is the chairperson of Central AHA, and she's the professor of pediatrics and neonatology, Madam. And so I welcome you, Madam. And I also welcome you to please say a few words. Thank you.
Thank you, Sunita and Swati and Chitra. I can see all of you and my colleague, Dr. Geeta Patil, many others, Dr. Neha here. I'm really happy that on this very special day, we are celebrating this in a way that to empower our young girls. It is very much needed topic, menstrual health, menstrual hygiene, and all this has always been a very less talked about. So it is the need of the hour, and we started talking about it. It should be as routine as possible, as healthy as possible, nothing negative about it. And there are so many myths around this issue in our society that we need to talk more often about this topic. I'm so happy that IFP Raigad is taking up this topic boldly on a webinar, and we should conduct some workshops, and there should be, I think, some talks in the schools and colleges, though it is closed now. I expect that our AHM members will go out to the community and speak about it, because we doctors technically can talk about all these myths and how we can bust all those myths. So hygiene is extremely important. At the same time, we need to also talk about a little around reproductive health. So when we go, we just talk to them about, many of our people talk to them about how to use the pads and how to dispose and what is normal, abnormal. But I think we should also please add that they are ovulating and they can become pregnant. We have seen very accidental pregnancies coming in, and then they say they never knew that that they had intercourse or physical intimacy can lead to pregnancy. So we have to speak about ovulation also, which is related to menstrual cycles. I think this is one message we should give them. Let us give them full knowledge, not just about the part knowledge about it, at least age appropriate. And I really thank once again all of you to bring this onto the forefront today. Let us celebrate it and no more feeling shy about it. Let us talk openly and celebrate this. I think all the boys also should know. All the men, women, everybody, the society, everybody, all of us, we need to talk about it. Thank you for arranging such a nice program. All the best for this session.
Thank you, ma'am, for your blessings. Now, let us know our today's experts. Neha, can you share the slides? Our first expert for the day, Dr. Geeta Patil, ma'am. Can you share the slide? Ma'am is a senior consultant pediatrician. She is immediate past chairperson Central AHA. She is adolescent health specialist and counselor at Chaitanya Hospital and visiting consultant at various hospitals. Ma'am is National Scientific Coordinator for IIP Ki Baat Community Ke Saath 24-25. She has received many awards and contributed chapters in various books in adolescent medicine, and she has special interest in adolescent medicine, infectious diseases, and nutrition. So we welcome Dr. Geeta Patil, ma'am. Now I read about Dr. Archana Thomre. Ma'am has completed PG from prestigious BJ Medical College and is consultant gynecologist at Thomre Multi-Speciality Hospital, and she's practicing since last 24 years at Khanda Colony, New Panvel. And we have Dr. Neha Singh. She's a pediatrician and adolescent consultant. She's secretary AHA Raigad. She's editor and joint secretary of IIP Raigad. She's co-chairperson Maha IIP Women's Committee 2023. I also welcome youth Kaina, Ridhima, and Pranaya, who will be sharing their period stories. Now I invite Dr. Neha to start the session.
Thank you, Dr. Swati. Good afternoon and welcome all. Menses, periods, menstruation, blood, gross, secret, hide it. But why? It's a natural biological process, right? And that every girl and woman goes there every month and for about half of her life. A phenomenon that is so significant that the survival and the propagation of a species depends. And also, we consider it a taboo. We feel awkward and shameful talking about it. When we get first periods, Minaki, we are told to keep it a secret from others, even from our fathers, brothers, and uncles. Later, when the chapter appears in a textbook, the biology teacher skips the subject. You know what we learned from it? We learned that it is a really shameful to talk about it. We learned to stay unaware about the details of the period and the importance as well as the stigma in order to stay decent. We learned to be ashamed of our own body. Research in various parts of India show that 3 out of 10 girls are not aware of menstruation at the time of their first period. And in some parts of India, this number is as high as 9. You will be surprised to know that most of the girls who do not know about periods at their time of their first menstruation thought that this is a dirty or impure blood and they are in crime. They are when they bleed. So I would like to ask Geeta ma'am to tell us what is menstruation cycle exactly and how long a cycle lasts for.
Thank you, Dr. Neha, and thank you, Dr. Swati, for your kind words. And at the outset, let me thank AHA Raigad, IIP Raigad, and very obviously, as you told, the NGO Rotary Club Khargar in Innerville, Club Khopoli, and Rotary Club Panvel also joining with us. So I am going to talk in little simplified term because we have got a mixed crowd. Is it not, Dr. Neha? So if I go on talking about the scientific word, everyone may not be able to follow. So I'm
Yes,
going
ma'am.
to tell simple thing. And first thing, let me congratulate for taking this topic, which is very important and less talk even in conferences. So we have to talk more to make it little better. So already it is told that safe period will cause a strong future, and period friendly world can be created by us. So it is not that difficult if you start talking. So what is a menstruation? I think simple word, because we have got adolescent with us. It is a monthly shading of the uterus lining through vagina, and this is called as period. So let us see what is a menstruation. So menstruation is a hallmark of the very important stage of the female puberty, and it starts 2 to 2.5 years after the breast bud develops. That is called as thelarchy. And this is menarche, as it is called as first occurrence of menstruation, some technical terms. And this menarche doesn't come to everyone at the same age. It may be from 9 to 14 years. I think there is a Ridhima, Kimia, all are there. They should listen. And age of menarche depend on the genetics, nutrition, race, and socio-economic status. So what is the normal duration? It is about 2 to 8 days. Cycle should be between 21 to 45 days. How do you have a menstrual cycle? From the first day of the menstrual cycle to the first day of the next menstrual cycle. Total blood loss should not be more than 20 to 90 ml. The use of the pads, I will tell pads because as a pediatrician, we are not talking about tampons much or menstrual cups. Maybe that may go under the domain of gynecologists to tell us. It is 3 to 6 pads per day. Why I am telling? Because many of the parents come to us and tell, oh, my girl has got periods are very heavy. Then we ask them how many periods they use, because sometimes they perceive that it is high. It may not be just 25 pads per cycle. The first 2 years after the menarche, the cycles may not be regular. That is very important because how it starts, it is a hormone from hypothalamus, pituitary, and ovary. I think all of us we understand hypothalamus, pituitary, ovarian axis, which matures, and hypothalamus stimulates the pituitary to have a follicular stimulating luteinizing hormone, and then ovary also will have estrogen and progesterone. There is a cycle is there. I think all of us are quite aware of that. And if why I am telling this is a normal menstrual cycle, if anybody deviates from this normal, maybe sometimes after menarche the cycles may not be regular because they are called as unovulatory, as this axis is immature. So there may not be ovulation happening. So this is very important to analyze and to be analyzed by a doctor. You should not take it because your grandmother, grandparents, or maybe uncle or auntie or neighbor say, oh, it's okay, don't go to doctor, but not. You should consult once at least. It's just like you go and measure your height, weight, and see your growth. Same way it is a menstruation also is required to be uh, known by the expert. And as pediatrician, you are in contact with a pediatrician, go to a pediatrician. Every pediatrician will help you, whether he is a male or female. So Dr. Neha, I told that this is the normal menstrual cycle to be understood by a common person and a teachers, parents.
Yes. And Dr. Archana, I would like to know from you that once menarche starts, then how long is it, how it is related with the height of the girl? Ma'am, please unmute yourself.
Height won't be affected much because there is a growth hormone that is also secreted, and till 18 years of her age there will be growth in there will be growth. Can you hear me?
Yes, ma'am.
Okay.
Yes, yes.
Can I add on as a pediatrician's perspective? There is
Yes,
a
ma'am.
maximum growth height velocity, maximum height velocity between the thelarchy and menarche. So this is a very crucial period for us to tell the girls' parents that have a good nutrition, have a good exercise. Though they may be genetically short, we can compensate. I think I agree, Dr. Archana madam, that it may not be. But after menarche, growth is maybe some of the girls may be more, but it doesn't happen as it should happen before the menarche. So we tell as a pediatrician, thelarchy is a very important point because 2.5 years are in our hand to give them a good nutrition, advise them exercise. This is very important thing to be remembered by all the teenagers here.
Okay. So there would be millions of girls out there who would be ill-informed, while it is generally believed that menstruation unawareness, and misconception is a rural phenomenon. But it is much as urban as well, and it exists in the educated urban class also. Girls nowadays get their period in class 5 and 6, but our educational curriculum teaches girls about periods only in standards 7 and 8. And since it is a taboo, teachers still skip the subject altogether. So, school does not teach girls about periods. Parents don't talk about it. So, where do the girls go? Geeta ma'am, why periods in the early age are coming up and what are the consequences?
This is very important question for us to understand. Menarche, I told 9 to 14 years, but now I'm very sure if there are some endocrinologists or senior pediatricians that menarche is occurring little early. It may not be pathological. Below 8 years, we call as a precocious puberty, where the bone also grows and the things are happening. But this early menarche, I am not telling it is abnormal. It is a normal variant. And why it is happening? Because obesity, because that BMI will be high. Endocrinologists can tell us at particular BMI the menstrual cycle starts. Then lack of physical activity, eating up the junk food. Junk is also, and endocrine disruptors. Where are these endocrine disruptors? These are the chemicals which are present in the cosmetics, soap, shampoos, then carpets, paints. Many things are there, and we know the plastics also, that BPA, phthalates, and these are day in and out we are in contact, and these are also reason for that. We know that some of the food products are injected with the hormones, and obviously the stress of the studies and life. Why it is very important for us to know is not just that menarche happens, it causes a psychological distress in young girls. They cannot manage, they get bullied. Some of them in rural area, they get married, early childbirth, and they may be subject to sexual violence. And very important for us, early menarche may cause early fusion of the epiphysis, and the final height may be less than what is potential genetic height. And now the new study tells that early menarche, maybe obviously it happens with the obesity and people consuming junk food, metabolic syndrome, hypertension, cardiovascular diseases, diabetes type 2, all these things are being related that if you get a early menarche. It is not proved, but early menarche is happening, and these are the reasons, and we have to be very cautious. Girls have to remember, eat a healthy food, good lifestyle is very important.
So, if we are talking about menarche, Dr. Archana, I would like to ask how long to wait for periods if they don't get? Ma'am, please unmute yourself.
You can wait till 16 years. There is a term called delayed puberty.
Yes.
After telarchy, within 2 years, a girl should get her menses. If she doesn't get her menses within 2 years, then again you have to investigate the girl. And by the age of 16 maximum, she should get. Or you can wait till 17, but the girl should be kept in frequent follow-ups.
So we got a very important message from both our experts. What is menstruation, what is menarche, and what is early menarche, and how to proceed. We should go to the pediatrician or gynecologist if it doesn't appear till 16 years of age. Another issue that periods bring in their lives is the social restriction and that are imposed upon the girls and women when they are on their periods. I think you all must be aware, but I will still like to list them. When girls experience menarche or periods, like they are not allowed to touch or eat pickles, not allowed to sit on sofa, asked to wash their bed sheets or sleep on floor, not allowed to enter the kitchen or puja ghar. It's considered impure, and most of the time it is the older woman who imposes such restrictions or younger girls in a family. So Geeta ma'am, how can family, teachers, school, society help in overcoming these taboos?
So today's our topic is mainly mean for that only, to remove these taboos. Why we feel, oh, menstrual cycle is a curse, it is a impure, and what it goes, lack of education, awareness, it may lead to infections, and so many other issues are also there, as already been discussed. So how we are going to do in family? Main thing is family, the mothers, father, siblings, including brothers, have to be included in this talk and educate the girls about the puberty and menstrual hygiene, very important, and provide the girls with a proper sanitary pads, or maybe gynecologist can tell about the menstrual cups, or if it is not used in rural areas, some of them use a reusable cloth pads, and help them to understand how to use and dispose them, not only to use, and many of them don't know how to use the sanitary pads. And emotional support should be there, and they should not put a restrictions. See, it is not that a menstrual cycle means something they have to stop everything. Everybody's capacity is different, but not to do exercise. There are many sports people who have played during their menstrual cycle and won the medals. So it is not that, but only thing, proper use of sanitary pads, and I think swimming champions also, but that I think Archana madam can elaborate to us. This is the way family should get involved. Mother, father, brothers, not only sisters, aunties, uncles also. All of them should be, it should be friendly talk should be there. And there should not be anything stigma or something to be hidden. We have seen the Padman movie, it is accepted now. So as such, the original person was Arunachalam, who was from Coimbatore. He is a small time entrepreneur who started these sanitary pads things. So this type of thing should come in the
Asha,
family.
would you like to?
Yeah, this taboo thing was there because in olden days, women could not work when the menses were going on. Heavy work was there, so it was difficult for her. She used to get exhausted, so they preferred to give her rest. So she was asked to restrict certain activities, like pujas used not to be just a small puja, it used to be a long puja, preparing for the puja, then going to the temple. Everything was exhaustive, so they started restricting her from doing certain activities. But now, since so many other life is so luxurious nowadays, so she should not be resting. And now with pads and all, menstrual life has become quite easy for a woman, and we should break the taboo by educating the ajis or the grandmothers. Those are there nowadays.
Rightly explained by both of you, ma'am. Girls are because these girls are growing up accelerating such restrictions as norms, and that propagates from generation to generation. In many cultures, they are not allowed to sit with their family members, even in when they are in periods. Also, some are not allowed to take bath during periods. So, Geeta ma'am, please tell us about menstruation hygiene and the tips what to be followed by young girls.
This is a very important question because we should talk about these things in the clinic, because if we don't talk to them, they are not going to understand what is how to maintain the hygiene. So first and foremost, the people go on asking about the pubic hair, the trimming of the pubic hair, not I think the plucking of the hair or maybe using the hair remover cream is not usually advisable. So trimming of the hair, then maintaining that area clean by taking bath. Bath need not have to be every day, twice may not be possible, but at least once in a day. When they go to the toilet, they should clean from front to back, have enough fluids, and if they are using reusable cloth, that should be washed every 3 months, and then the sanitary pad should be changed every 4 to 6 hourly. This we have to highlight them, and important thing, let them not forget about proper disposal also, because proper disposal is not available many places. That is also part of the menstrual hygiene. Once they get used to that, that will help to maintain the proper hygiene. So all these things are very important, which we should go on talking to them. And any abnormal thing they feel, that they should immediately inform their caretakers, and caretakers will talk to the and important thing, they should not wear the tight garments, because many of the girls when they go to school, they wear those tights. That should be avoided. Cotton loose clothes should be there as much as possible. And chemical free hygiene products, nowadays there is a craze that intimate wash is there, no? So that is not required to be done, because many girls come and ask us about that. So I think try to avoid that. Simple hand wash it, water cleaning is also enough, and simple soap is also enough.
Yes, I also wanted to ask about this high intimate wash should be used or not used.
No, madam, it should not be used because it reduces the pH, it changes the pH of the vagina, and the chances of getting vulvovaginal infections are more. So, the minimum you trouble that area, the more. Don't use any products to that area. Just wash it once in a day with soap and water, and whenever you pass urine or something, you can just use simple water and dry the area. No need of frequently using those commercially available washes. Second is, we should tell these girls that it will prevent if they maintain the hygiene, it will prevent them from getting urinary tract infection. It will avoid those rashes, genital area rashes will be avoided, maintained. The reproductive hygiene will be maintained, health will be maintained, because there will be no infection to the uterus and the further infection to the pelvic organs. And this will also help in reducing the chances of HPV infection, which can give rise to cervical cancer. So once we tell them why they should maintain this hygiene, they will try to keep it healthy for themselves.
Thank you very much, madam. I think I should add on everywhere the HPV infection now, because we are not talking about the HPV infection and menstrual hygiene. It's a great point that we all have to remember.
Yes. So menstruation hygiene plays a very important and because it has a risk factor for reproductive tract infection. But in our country, 12% of the girls and women have access to hygiene ways of managing the period. That means 88% of the girls and women use unhygienic ways to manage their periods. So, Ashra ma'am, there are several products in the market available, but many of the girls are not aware about all those except sanitary napkin. So, would you please let us know what are the other ways or what are the other products and how to use it?
Basically, a girl should be prepared that she is going to get menses every month. Okay, she once she gets a menarche, then she should be aware that this is going to be monthly thing. So, and what is to be used for this, and how to diagnose that she's going to get her menses and when she's going to get. She should know, she should understand her body. Some of them may have little cramps in the lower abdomen, some backache, some pain in the inner thighs. Some may have more severe pain, nausea, vomiting, and some of them may have breast tenderness 2 days prior to that, nipple pain may be there, and a little sticky, thick mucoid discharge will be there through vagina just before the menses starts. So that girl should know that she's about to get a period, so she can store the stock of whatever sanitation method she's going to use during her menses. So what are the methods of sanitation products available in the market? Simple is cloth, but there are different cloths available, not the usual ghar ka kapda. There are menstrual pads made by cotton. She can use them, which she has to, once she's used it, if she's outside, she can change it, but she has to keep the unwashed pad in a plastic. And when she returns home, she has to wash it immediately with hot water and soap and dry them crispy dry. She can use cloth that way and store them after drying. She can store them for the next cycle. Or there are pads available. Young girls who just start menstruating can use pads. That is easy because they will not like to wash and all, and the girls will not be able to manage that. So it is better to use sanitary pads. We have to show them the packet, open the packet, show them the packet how it is, open it, show them how to apply, how to fix it on a panty, and how to wear it, how frequently it should be changed. Tell them that it should be changed every 4 to 6 hours. A pad should be changed. If it is that at night, during night, she can use those high soakage extra large pads she can use, which has a capacity for 8 to 12 hours. If a girl after 18 years or so, she can, if she wants to, she can shift to tampons. Tampons are it is a
Capsule type.
capsule type, which is inserted into vagina. It absorbs blood, and then she can, with a string, she can pull it out once it is so. Again, she should not forget that she had inserted tampon inside. Again, it will get infected. It will call bacterial infection. And the last is available nowadays is menstrual cup. It is a very good thing that is recently come up, and there are different sizes available: small, medium, and large sizes. A female can choose according to her vaginal size, or the if she's unmarried, she's not sexually active, she can use the smallest size of cup available, and depending on the size of vagina, she can go change to larger sizes. She has to fit the cup very nicely in the vagina. It is very simple, just she has to fold it, C fold and U fold, and it will open inside the vagina. Once she inserts it inside, it will open up in the vagina and fix to the cervix. The blood will be collected in that. It has a loop to pull it down, and when she's in the washroom, she can remove it, wash it, and wear it again. And when her menses are over, she has to sterile it by washing it in warm water and store it. After drying, she has to store it so that she can use it for next cycle. She can use this for years and years together.
And what about the cotton pads? How long they can use the cotton pads?
1 or 2 years. If they are maintaining them properly, they have to wash it properly and dry them properly. Basically, they have to see that there is no fungus or anything growing up on that, depending on the weather, which weather they are using it.
So the market is full of such products, and all it depends on the girl's personal choice and also the convenience of using and managing it.
Yeah.
Uh,
If she's traveling, then she won't be. It is difficult for her to carry those cotton pads where she will wash them.
Yeah.
If she's a sports person, she can use menstrual cups or tampons. During swimmings, also she can use those tampons or menstrual cups.
I think, is it possible that somebody has asked the question, maybe questions will be taken at the end, but always there is a dilemma in myself also to tell them when they are not sexually active. Because in our country,
We usually, madam, but now we are seeing girls who are unmarried, they come to the OPD and they are using menstrual cups. Because they are not, now they are not worried about the virginity part.
not for virginity, that insertion of the menstrual cup.
It may be painful, but I did ask one girl had come and she said it was not very painful.
What is the earliest age you advise menstrual cup?
After 18 years, I tell them, not before that.
Not before. That's the way. Because they
Yeah.
don't come to us usually after 18.
And they're too young to understand all the anatomy and everything immediately after menarche. It is too early for them to know everything immediately.
Tampons?
Tampons also after 18 years. Because once it is swollen, it is little painful to remove it.
So Archana ma'am has explained all the products available in the market, and Geeta ma'am has also told us when to change them. But Geeta ma'am, I would like to know what are the disadvantage of using sanitary napkins, and most important, how to dispose them.
See, very important thing is we use sanitary pads a lot. I think there are some data is there. People are not aware how to dispose I think I'll tell you the correct the number, how people are not able to understand how to dispose the sanitary pad. So just let me once, because the sanitary pads are disposed in various ways. Because in the school, they don't have facility to dispose in a proper way. Many schools, they don't have a proper waste disposal system. The sanitary pads, tampons, cups, blood is disposed with the wet or dry waste many times. So many of them just throw in the dustbin. Some of them just throw in the open spaces. Some of them dispose by burning. Some of them dispose by burying. Some of them just throw in the commode to flush it and it gets blocked. And this is in an unscientific manner done, because these sanitary pads, what we get it usually contains some microplastics, they contain some synthetic chemicals, which are definitely bad for the environmental health. And unfortunately, we are never thinking about the environmental hazard, which is going to harm them only later. So to have a eco-friendly sanitary pads, maybe some research, biodegradable sanitary pads are very important, so can be disposed in a better way. And all the schools, community centers, toilets, bus stands, trains, railway stations, maybe everywhere there should be sanitary vending machine, sanitary pad vending machine, and proper disposal of the sanitary pads. Incinerator in the rural area also, as such incinerators are available, but they are not used properly. So this is very essentially required to proper disposal of sanitary pads, and availability of the biodegradable sanitary pads is very important.
So about 85% of girls and women in India would follow one or more restrictive customs in their periods every month. Can you imagine that this does to their self-esteem and self-confidence of a young girl? The psychological trauma that this girls have affect their personality, their academic performance, and every single aspect of growing up during their early formative years. And because of this, many girls don't open up with their discomfort, painful cramps, bleeding issues, and they just bleed every month, being ill-informed about menstruation, about PMS. So, Geeta ma'am, what would you explain about the PMS? What is it?
Premenstrual syndrome. And premenstrual syndrome, many of them, I think gynecologists may be very well versed, because girls we don't see that much. We see after second decade, but some of them are getting it just 4 5 days before menstruation, 3 4 days after that menstruation starts. And if it happens in 3 successive period, it goes under DSM-5. It is called as premenstrual dysphoric syndrome. But what it is, because of the fluctuation of the estrogen, progesterone, water retention, it may cause emotional problem, physical problem. Emotional is, some of them are very anxious, depressed, irritable, mood disorder, and sometimes they behave in a very violent way also. But this can be managed with the relaxation techniques and talking to them. But that fluid retention causes abdominal pain, headache, bloating feeling. Already madam has told, breast congestion like feeling, swelling on the hands and feet. This is a premenstrual syndrome. And if it disturbs the day-to-day activities, definitely it requires a proper management, including cognitive behavioral therapy. See, I have seen only one girl who is had a premenstrual dysphoric disorder, but she had a other mental health disorder also. It was not only that.
So, Archana ma'am, apart from PMS, we would like to know about other various issues like dysmenorrhea, amenorrhea.
Dysmenorrhea is it is a very, like, they experience pain, and pain threshold. Everyone has a different pain threshold. For some, very severe pain is also very minimum. For very few, very minimum pain also, they start shouting. And
Manage if they are having this type of problem.
then we can ask them to start with yoga, a good diet, and if the pain is very severe, they can take NSAIDs like aceclofenac or rotavirine.
Okay. We can also use hot water bottles.
Hot water bottles, and some rest for some 1 or 2 hours. She will relax, and then she can resume the work.
What we experience as a pediatrician, we use that prostaglandin synthetase inhibitor, naproxen or mefenamic acid. That
Yeah.
gives a really good relief, because we don't use that much aceclofenac and all. I think there is no harm in using under proper supervision, but naproxen gives a really good
Yeah,
relief.
it is also good, ma'am.
Otherwise, they will miss the school. They won't go to school. They will miss the important occasion. They may lag in the academic performance. They miss their sports things. All these things we don't want
And
to
if dysmenorrhea lasts for more than 2 days, then they should get investigated if there's some cyst or endometriosis that is coming up. But it will take some time, not in a very early age. After 18 or something, it will start.
we tell them that first 2-3 days this discomfort will be there. Many
Huh,
of them
first
will.
huh. But if it is very severe and very persistent, then we ask them to investigate.
As we told that menarche is happening early. So this is also we have to tell them that some of them unovulatory cycles will not have pain. And these unovulatory cycles, if they early stage only, if they start getting pain, then our antenna should be up, should be some problem.
Yes. So these we had a very excellent discussion on various aspects of menstruation and menstrual hygiene and the products and how to help the girls understand about menstruation. Geeta ma'am, what advice would you give to the parents and teachers? Like how to talk about periods comfortably to their daughters or sisters or young girls?
Parents have to have an open discussion whenever the chance comes. Both mother and father both have to talk. And even if brother is there, I already told that family involvement is very important, and including grandparents, and to be told that it is not any stigma for that. Important thing in the school also. The teachers, including male teachers, to address this menstruation very respectfully and supportively. There was one girl who got at the age of 10 years, as you already told, कि Baba, the education of the menstrual hygiene starts in a school in 7th and 8th standard. But as we are telling early menarche, let us start in 5th standard. We can talk to these things to the policymakers so they're already well prepared. Otherwise, it is very difficult for the teachers to make them to understand and integrate the age appropriate menstrual health education, and they should have a safe private clean toilets and sanitary products, pad availability which is not there. Government has got a menstrual hygiene scheme, but that is not available. Sanitary pad vending machines, they, I think 8 rupees one sanitary pad was sold, but that is also not available. So advocacy is quite poor. Parents and teachers have to talk in a age appropriate way and make them to understand this is a very important part of the puberty, and you have to take care of yourself to avoid the infections. And this is a natural phenomenon, not to put in their head, oh, something is different. This is a natural thing, and you need not have to disturb your activity unless and until it is very severe.
So Archana ma'am, would you like to add something?
Yeah, when they are washing the area and all, they should not put finger in the vagina or put some water or try to clean the vagina by flushing it with water or something, that is douching, because it will give rise to infections.
Yes. So I know this discussion can go endless and there are many taboos, many misconceptions, myths, but we would like to hear from our youth also their story, their experiences, their queries. So, Swati ma'am?
Yeah. Um, Basically, it was a very informative and impactful session which shed light on crucial aspects of menstrual hygiene, and it really provided much needed clarity and education on menstrual health. So now I would like to invite youth Kaina to introduce herself and share her period story. You can tell us, Kaina, about how did you start your periods and how was the initial experience?
My name is Kaina. I'm preparing for Bachelor's of Design. I have completed my 12th board. When I first got my period, I was in school during sports period, and I thought I had cancer, and I thought I was going to die. So I didn't tell anyone. And after I came home, I thought like, should I tell my mom or not, or she'll cry if I'm gonna die or something. So then eventually, like later, I told her that I'm bleeding there. So she was like, she gave this unexpected reaction, like, oh, you're a woman now. So, yeah, that was surprising at the point.
Okay.
And I have really severe cramps on like the first 2 days. So I have to skip my entire activities for that day. And I get like vomiting, I get headaches, and I end up taking 3 to 4 painkillers in a day.
Oh,
Um, and yeah, it just
I know
gets
you
in
are
the
a
middle
sports
of the day.
person also. So how do you
Yeah.
manage?
For that also, I end up skipping because I can't do anything.
So what if you are having the competitions, your sports competition on that day of first period day? Then how will you
I
manage?
actually had to skip that competition because of it.
No, Kaina, you should see a gynecologist now.
I have, they say it's like because of hormonal changes.
Geeta ma'am, would you like to?
See, that is the one which we wanted to tell you, as Dr. Neha already told, premenstrual syndrome, dysmenorrhea, that is the pain. I think we can get over all these things without skipping the sports or our academic activities by consulting a little empathetic gynecologist. I have seen many of the gynecologists, they say, oh, you are having a pain, why are you missing it? They don't explain. So you are little elder girl, but I think you should consult a gynecologist and ask why I am skipping. Is it really something which needed to be, as you have to undergo one ultrasonography? Have you undergone
Yeah,
ultrasonography?
I have. She said it's because of hormonal changes.
It's okay, hormone. They will give you some medications which gives you totally relief of your pain. Follow their
I
instructions.
actually tried that too. She gave me a different type of painkiller, but that did not work, so I
No,
had
Archana
to
madam
put
is
that
there.
down.
She can enlighten more, because if Dr. Archana can tell, it will be more valid, because definitely your age is above 18 years. We don't come across whether you are having just hormonal things. They give you that combination pill in a cyclical way, which goes on reducing your pain also. Have you having a abnormal bleeding?
Not as such, but like my bleeding changes throughout cycles.
Okay, is it
Over
regular? Is it regular?
Yeah, yeah.
So I think little relaxation techniques already Dr. Neha told, breathing exercises, even meditation, mindfulness, many things help.
Yoga.
Distracting yourself, yoga.
Geeta madam,
Yes, sir.
this is a very important common scenario we come across, and maybe the kind is very correct. But I request the panelists, you and Archana madam, to clarify clearly what they should do, madam. This is a very common, exact question the Kaina has put it across
Yes, yes, yes. I think
the
Dr.
chat.
Archana is back now. Dr. Archana, this girl about near 18 years, she is getting dysmenorrhea, severe cramps. She misses her sport, she misses her school. So I just advise her to see a gynecologist, get the investigations done. She told gynecologist had told her some hormonal effect, and still she's a sports girl and she misses sports. So you should enlighten that.
She can if the all her reports are normal, if there is no fibroid or nothing, we can she can take a analgesic like painkiller, what they in common people's language they call. She can consult the doctor and she can take those pills the doctors have prescribed. She can take on the day of menses and the next day. 1 or 2 days it's sufficient, and there's no harm in taking those two
She is
pills.
Like for
not
2
getting
days,
relief,
I
she
have
says.
to take like three painkillers.
Hmm?
Like in one day, I have to take like three painkillers.
You will have to rule out if there is no endometriosis.
I
What
think you
is
must
that?
see a very good case to tell Dr. Jalil sir. She has to be under Dr. a gynecologist's consultation, because as Archana madam already told, it may be something else also which may be treatable. So
It may,
Absolutely, madam. The
it can be
success of this
treatable, and
seminar, the success of this seminar is looking at this kind of queries,
if
madam.
she's requiring 3 tablets, the it may be something else also.
I too, can I just,
Yes, Himabindu
can I,
madam.
yeah, I was just hearing through. I think this is little, 3 tablets is little not, looks like more than normal pain, or maybe the perception of the pain is more, or some organic or other things, like mentioned by gynecologist has to be ruled out. Ultrasound and other thing, I think she said it has been done and she has seen a gynecologist. So did the gynecologist tell you anything?
No,
China?
not really. She said everything is normal.
Normal. Then, if everything is normal as per the gynecologist, then you require counseling, and maybe if organic things are ruled out, then we have to think about the perception, how you are reacting to the pain, and are there any other, like during menses only, it comes.
Yeah.
Then you require counseling. I think you are the right case for counseling.
How is your nature? I think I'm just not asking you. Do you get disturbed with smaller things?
No,
No.
like when I'm
You
focused, I
get
just do
stressed
it.
with the exam or something happens in the family,
Time to time.
but not more than other of your colleagues, friends, more than your colleagues?
No.
No. Maybe you will get all right, just little relaxation, exercises.
Your pediatrician? Who's your pediatrician?
I
Remember
am
him?
not.
You remember him or her?
She's from Bangalore.
Yeah.
Bangalore. Acha, you're
Which
now
area you are?
I think Dr. Neha, you have to help her locally if she's with Raigad. You have to help her. And it cannot happen in this webinar. You have to sit her with to her one-to-one and sort this problem out, but it requires attention.
So Geeta ma'am,
By
well, because she is in Bangalore, so
oh,
with
You are
ma'am.
in a Bangalore, you
in
can.
Bangalore. Then please meet Dr. Geeta madam. Yeah.
Okay. So what I am telling, I don't feel that you are having anything. Maybe some cyclical pill, as Dr. Archana also, any gynecologist will help you. We also can help. And already there is some answer given. Can try cyclical progesterone before calling it functional. Very important. This is very important thing. See, because we cannot call as a functional until we prove that there is no other issue inside, because endometriosis, is it increasing, Archana madam?
Yes, it is in adolescence also it is coming up, and grade
Ah,
4 endometriosis is also coming.
and that requires little more specialized gynecologist, I feel, who is
Yeah.
knowing about certain things.
Dr. Geeta will help you along with the gynecologist.
Okay. Which area you are in Bangalore?
Uh, Near HSR.
Okay, I will just tell you later. Okay. So,
I will, yes, I will share her number.
okay. So now,
I think so sometimes deviating from the thing, like going for sports, आप sports person हो तो आप जाओ sports में या फिर किसी और चीज में अपना mind invest करो तो sometimes
प्रॉब्लम क्या होता है कि मैं उठ ही नहीं पाती हूँ, मुझे इतना पेन होता है.
okay. So
So that's the problem.
Swati
He
ma'am,
needs proper evaluation
Yes,
and
the
attention.
pain threshold varies from
yeah.
girls to girls, and I think that could be the issue. Okay, so now I invite youth Ridhima to introduce herself and share her story in brief. And how was her experience? Ridhima?
Evening, everyone. I'm Ridhima Parve. Even I'm a PCT student inspiring to become a doctor, actually. And I got my periods when I was in like seventh or sixth standard, and I already knew what this menstrual cycle is before. I had my mother and my sister talk to me about it. I already knew what all things happen, and I was prepared beforehand.
Very nice. This means your mother and your elder sister must have already explained you.
Yeah.
Who are few of the fortunate youngsters who are already prepared for that. So, Swati ma'am, yeah, we have question answer. Yeah. Do you want to, Ridhima, you want to ask something from Archana ma'am or Geeta ma'am?
Yeah, I wanted to ask to Dr. Geeta ma'am about food restrictions. Is there any food restrictions
see, obviously, I told you
to follow?
ultra-processed food junks. Please avoid it. It leads to many problems apart from obesity or some other problems. This also menstrual problems get disturbed due to the junk food. Have a lot of water and fat to be reduced, fiber to be increased, I'm very sure fiber reduces many things. Fiber, you know where it is. And fruits, vegetable, vitamins, minerals, all these things are required. Nothing to be avoided during menstrual cycle. That is not required. But have a healthy diet, healthy lifestyle.
Adequate sleep,
Yes.
adequate night sleep, not daytime sleep.
Yes, night sleep. Diet is, this is the diet. Stop junks. You know junk, no?
Yeah.
What is your perception about junks? You should know, because that is salty from bakery, all means very frequently eating junks. That also causes a lot of problem. Even premenstrual syndrome increases. PCOS is happening. I think people are talking a lot about PCOS. They contribute this thing to the faulty dietary habit, faulty dietary lifestyle, and inadequate sleep, as madam already told.
Yes. Do you want to ask something more, Ridhima?
Yeah, I wanted to ask to Dr. Archana ma'am, are there any ways to reduce PMS?
Your sleep, exercise, and healthy food. Or then we can, if it is troubling you too much, then we can put you on some pills.
Okay. Kaina, do you want to ask something?
Yeah, I have heard that HPV vaccination leads to bleeding problems and infertility.
No,
Sir, no, both of
it's
us
a
say
myth.
no. Very firmly no. Please take
No.
it.
Okay.
Completely a myth.
Yes, ma'am. Kaina, you want to ask anything else?
No.
Yeah. Okay. Um,
I
because
guess we are running short of time. It's already 5.
yes.
So,
So
uh,
at the end of session, I would request all the parents, dear parents, if you would be ashamed, mothers, especially if you would be ashamed of your periods, your daughters would be definitely. So please be positive, period positive, make your daughters confident so they can speak, ask. Let them also explore the world, breaking all the barriers. And I would like to have last words from Dr. Archana ma'am and Dr. Michael ma'am.
I think still there is a big gap. I think I can tell correctly only 36% recent data, adolescent girls in India, and 36% adolescent girls and women understand about the menstrual hygiene, and 26% use sanitary napkins effectively. So we have made tremendous progress. Padman movie was accepted. That Arunachalam Muruganathan from Coimbatore, he has made it so, I think at least people have started talking about the sanitary pads. But this gap can be filled by pediatrician, gynecologists. Now see, these girls were asking the questions. We might have felt it is a very primitive questions, but these are the things community, parents, teachers are having mind. We should have create the awareness among them, and government should also, I feel so, invest in this, because there is a menstrual hygiene scheme is there, but it is not implemented. Infrastructure has to be created. Then only we can say period friendly world. All of us together we have to do, and then safe period will have a very strong future. And definitely these girls are the future of our country. So we have to make them not only by advising vitamin, minerals, and please remember, these girls after the menarche they will have little heavy period. Their iron may be, hemoglobin may be low. So they have to see that their hemoglobin is maintained above 12 gram. This is the age below 2 years, and during adolescent age group they are prone for nutritional anemia. So maintain about 12 gram, whatever may be there. If it is not there, Kaina, you are there, your hemoglobin, if it is about 12 gram and everything is fine, you need not have to immediately worry. So this is very important message for us. Maintain menstrual hygiene, inform the caretakers, take proper opinion, medical opinion. That is good for you to have a strong future.
So, Archana ma'am, there is a question for you. Vaginal discharge before and after menstruation.
Unmute, madam.
Ma'am, please unmute.
Before menstruation, it will be sticky, whitish discharge, and during ovulation, that is mid-menstrual, it will be little clear and little more discharge it will be there. And after menses, the discharge will be less.
Okay. And what is the role of combination males or only estrogen in severe dysmenorrhea?
Pills.
Yes.
For young girls, combination pills will be better.
Okay.
And Archana madam, this tranexamic acid and
Tranexamic acid.
and mepanam, because we don't advise this all combination hormones.
Tranexamic acid we advise for menorrhagia if the bleeding is more.
And then the combinations are available. Some of them they're paid
Because
off.
it is mostly associated with pain. So mefenamic acid is there.
I'm not telling the trade name, but what
Yeah.
pediatrician, I'm very sure PAS MF, everybody will be knowing.
Yeah.
To us, we advise that. And before sending to the gynecologist.
Yeah.
And it gives a relief.
Yeah. Because tranexamic acid has a very good effect on urogenital tract bleeding.
Vikas sir, you want to ask something? Your hands were raised.
Yeah, but I was really wondering to see the youngsters like Ridhima and Kaina discussing their issues, and it is really giving a more insightful discussion. How from it is going from a theoretical to a practical way of discussion. What actually they are feeling and what actually as a clinician we should pursue the problems of our patient. One side we say that what might be the emotional status of a child, and paradoxically we ask the questions to the patients which may make them embarrassed. So I think personally I feel that even while counseling of a younger girl, as a pediatrician or gynecologist, we should be very sensitive. We are dealing with this new women, young women, and they might have some different perceptions which might be nonsensical in our sense, but it has really a depth in their way of thinking. So the carrier message which I got from this whole discussion is that I should be very cautious while counseling, and if I'm not able to counsel, then definitely I should take help of my gynec friends. And one more help is that there are some drugs like tranexamic acid and mefenic acid which can be used very occasionally to get the child come out of this pain. Thank you so much.
In some communities, there is a custom that they celebrate the menarche.
Yeah.
Yes.
They
That is very welcome.
they prepare sweets at home. They gift her with good clothes. They give a small party.
Yes.
That is
Vikas More, you told correct. Empathetic, non-judgmental attitude should be there to any teenager or young adult. Same way for this menstrual hygiene also, menstrual talk also. The celebration is a big celebration.
Over to you, Dr.
Yeah. I would like to invite Chitra ma'am to say some lines.
Neema Bindu ma'am wants to add
No,
something.
just was very interesting. I want to, Mr. Vikas, just wanted to know the boys' perspective. When did you know about menstruation? That about the detailed, the physiology. How do the men know, and when do they know? And in your case, when did you know?
Actually, in my case, I got to know through a novel.
Novel. Okay.
Novel.
And what age? At what age?
When I was in 11th or 12th.
Okay. So through books.
Like it was a novel by a doctor only, and he was describing how his colleague used to skip from the classes during specific periods.
So
then
what
I
is
understood.
your age at that time? What was your perception when you look at your colleagues? When they are absent or some reason you think is related. What was a normal boy's reaction? How do the boys feel?
I initially I first time felt that is really affecting their physical health, and it is they have to skip from their day-to-day occupational duties. Then it is really a cause of concern. I remember one of my colleague intern. she used to cry when she used to work with me. She used to cry like whole day. Like our duty used to be together. We were working for almost a year together, and during the disseminal period, she used to just go and rest in a resting room. And she used to cry, cry, and cry. Then I first time saw that how much trauma and pain a woman suffers during this period. That was the first practical. I was practical witness to a dysmenorrhea during my internship days.
Thank you. And one more thing was, this. I think I was asking how we can, talk to the boys. Boys should know, I feel, and will the boys receive it properly, or how should we talk to them? At what? I think they should know. Obviously, when they get married, they'll know everything, and they know about the sisters, their mothers, and the family. So we feel that we should talk to them about this. At least there should be some compassion, understanding, empathy, instead of teasing them or making fun of them. And the girls are so scared because they'll stain their clothes in the school, and that white dress on Fridays on the sports day. It is so much scary for them. So these are the things between the boys and girls. They are so worried that the boys will make fun of them. I think gender.
Very true.
respect.
Very true, madam. Very true.
The education of
Mm.
girls and with education of boys is very
Yeah.
important. Because the boys should know how to respect and have empathy for their colleagues. So
Yeah,
over
that's
to
the
you.
point.
Yeah. Now I would like Dr. Chitra ma'am to say a few lines on today's discussion.
Yeah, it was a very nice discussion, and I'm very happy that so much of logins, like more than 41 people, are there listening to you. That is the success of our webinar. Only 2 points I want to add for dysmenorrhea. That first is doing exercise will increase the endorphins and it will reduce the pain. That is the only point where the exercise is advisable in periods. Second is avoidance of constipation will also reduce the pain. Thank you.
Excellent points, Dr. Chitra.
Yeah.
Madam, I will give one suggestion to Hemabindu madam. This is like you have created a lot of modules, national module. We can put one module on this, start on 6th and 7th standard students, just to create awareness about it, madam.
So already it is there in my mind now, sir.
At school level.
Yeah. Actually, Aki has created, sir, module. Geeta also
Yes,
been
I
knowing about
talk
it.
many things from Aki
Yeah.
only. So
Yeah. Aki has
I'm
created
a
Swati
volunteer
Bhavi
of
madam.
Aki.
So we can take
talk
her
these things
permission
to the school
and
chief.
do this. Yeah. We have a module already, sir, through Aki and Swati Bhavi madam. And we will do in collaboration. I think definitely there's a scope for us to work on this.
Thank you, madam. God bless you.
Yeah. Thank you.
Now I invite President of Inner Wheel Club Khopoli to share her feedback on today's topic. Jayashree madam.
I think Vice President Dina is there.
Okay.
Jayashree madam is there.
Yeah, good. Continue.
बहुत ही अच्छा और बहुत इंफॉर्मेटिव ये सेशन था.
Okay.
Hello.
We can hear you.
Hello.
हाँ जी मैम बोलिए, हम सुन सकते हैं आपको.
हाँ, बहुत ही अच्छा और ये जरूरी है, ये लेना चाहिए था. मुझे तो ऐसे लगता है कि 2 महीने 3 महीने में ऐसा सेशन लेना चाहिए, क्योंकि अभी आने वाली जो जनरेशन है, जो लड़कियां हैं, उनको भी इसके बारे में बहुत सी जानकारी होनी चाहिए.
करेक्ट.
यस मैम, हम लोग जल्दी स्कूल्स ओपन होंगे तो ये सेशन लेने वाले हैं, बट अभी बंद है, इसलिए हम लोगों ने ये डे ऐसे वेबिनार में सेलिब्रेट किया.
Thank you, Jayashree ma'am. And anyone from Rotary Club of Kharghar Midtown would like to give some feedback? I guess the president is not there.
Sorry, I'm leaving. I have to take a patient for section. Okay?
No problem, Dr. Archana. Thank you so much.
Yeah.
Thank you so much, Archana ma'am, for connecting with us. Yes, Swati ma'am.
Yeah. So I think Dr. Amok or maybe Dr. Ravi Kiran, they can give their feedback if they are available.
Hi, good evening, ma'am.
Good evening. Good evening.
Seeing all the doctors qualified and much experienced doctors to speak on these lines is pretty much because the subject itself is very niche and people feels very shy to discuss about openly. So we are not in like 90s or early 2000s now. In 21st century, it's a need of hour, and we should really speak out about these kind of things so that as Dr. Ma'am mentioned, even boys should know by looking at their mothers or sisters so that they'll be able to assist. Okay, so I would request, thanks to Chitra ma'am, actually, she has given us this opportunity to be part of it. Along with that, I would request all the doctors, whoever is main persons behind this. I also wanted to have a one offline session for our club, so we can discuss later on these things whenever the possible dates and stuff. Because online is one thing, offline is also. I would like to pull the people so that they'll be able to know.
Yeah,
Yeah, sure.
Yes,
Sure.
ma'am. Appreciate. Thank you so much.
Okay. Thank you so much, Dr. Ravi Kiran. So let us all break the silence, break the stigma by empowering girls and unleash the power of menstrual hygiene. On behalf of AHA Raigad and IAP Raigad, I extend heartfelt gratitude to our esteemed experts, Dr. Geeta ma'am, Dr. Archana ma'am, and Dr. Hima Bindu ma'am, for their invaluable insights and knowledge. Today's session not only educated but also inspired us to approach menstrual hygiene with greater awareness and sensitivity. I thank the Rotary Clubs, Khargar Midtown and Panvel Elite and Innerville Club Khopoli to participate in today's session. And gratitude to our youth, Kaina and Ridhima, who shared their stories on today's platform and added depth to our discussion. I also appreciate and thank our dedicated audience members for their presence and attentiveness, which has been instrumental in making this session interactive and impactful. And special thanks to Dr. Neha, Dr. Gangolia sir, Dr. Sunita ma'am, and Dr. Chitra for making immense efforts to make this session an excellent one. Thank you, everyone.
Thank you so much. Very nice session.
Thank you. Thank you. Appreciate IAP Raigad for doing this wonderful session.
Thank you so much. Thank you.
Geeta, you are excellent, Geeta.
Thank you,
All
Hima
of you.
Bindu, madam.
Bye-bye.
Thank you for Dr. Neha. Did you understand the importance of teenager when we involve? It becomes more impactful. Our talks are just everybody
I
is
think,
listening many times because of
we are, madam, just a second. We are just live. Vishal, you can stop the live, please.
so. I think thank you very much. Thank you, Chitra,
Most of the
Dr.
schools, ma'am,
Ma'am,
most of the
sorry.
schools conduct session for girls. They take all the girls in a separate class and they educate about this. But I think even now they should be taking the boys also because that is the only way they can understand and understand the physiology of
Now we
menstruation.
are not taking separate classes in the school as I do school health.
Even I stopped it. Yeah,
We are taking
all-
boys and girls together.
Okay.
Bye. Thank you.
Thank
Thank you.
you.
Bye-bye. Bye, Chitra.
Thank
Bye,
you.
everybody. Bye, Sunita.
Bye.
Bye,
Bye, madam. Thank you so much.
Bye-bye. Bye-bye.
Thank you all the attendees. Thanks.
Thank you, ma'am.
Thank you, ma'am.
Swati ma'am for
Thank
moderating.
you. Okay, bye.
Okay, bye. Bye.